We will solve several dosage calculation problems where the nurse needs to count the intake and output of the patient for the shift. Here's our first problem. The patient drank half of the coffee, all of the soup and jello, and approximately quarter of milk. Calculate patient's intake in milliliters, and you can see the picture in front of you of what patient's tray looked like. So let's figure out how much in milliliters we need to put in documentation as an intake of this patient. Coffee was 240 milliliters, and patient only took half of it, so we can divide by 2. Got 120 milliliters for coffee. Okay. Next we have soup and jello. Soup was 12 ounces and patient took the entire thing. But I need to find how many is it in milliliters because my documentation is in milliliters. And I don't know how many milliliters that is. But I know that one ounce is 30 milliliters. So 12 ounces is X milliliters. I multiply on diagonal and divide by the third number. We're using DKP method to solve these problems. So X equals 12 times 30 divided by 1, and that's 360 milliliters. So my soup, 12 ounces of my soup is now 360 milliliters. Next, jello. Patient ate the entire thing of jello, and it's 90 milliliters. And the last thing to add is our milk. Patient drank about a quarter of milk, and the milk is 8 ounces glass. Divided by 4 is 2 ounces. What is it in milliliters? Again, if 1 ounce is 30 milliliters, 2 ounces is X milliliters, and you can see we're just multiplying 2 by 30 and dividing by 1, which is the same number. So 30 times 2 is 60. We got 60 milliliters here. Now we just need to add these numbers up all together. 120 plus 360 plus 90 plus 60
is 630 milliliters.
Here's our next problem. Calculate patient's intake for 8-hour shift if patient received LR continuously at 150 milliliters an hour, Zicillin every 4 hours, 1 gram in 50 milliliters of normal saline, 1 cup of water, 1 cup of ice, 750 milligram of clindamycin that came from a bag that was marked 1550 milligram in 500 milliliters, and patient received 1 unit of blood of 325 milliliters. Let's see how many milliliters we can document for the patient's intake for our 8-hour shift. Let's do one item at a time. LR continuously at 150 milliliters an hour. That means every hour for this 8-hour shift, patient was receiving LR. $150 times 8 equals 1200 milliliters. Next item, Zicillin. And we were given it every 4 hours. That means in our 8-hour shift, we gave it twice. And we gave 1 gram in 50 milliliters each time. So 50 milliliters is the liquid measure, right? 1 gram is the dry measure. We don't worry about that right now. We're just calculating liquids right now. So 50 milliliters once and 50 milliliters twice. We gave 100 milliliters. Next item, cup of water. And you probably know by now that 1 cup equals 240 milliliters. 240 for water. 1 cup of ice. In the instructions here, ice to water is 1 to 1/2. What does it mean? Is that most of the time, especially if you're using ATI resources, most of the time we calculate ice to water as 1 to 1/2. That means that if you have a full cup of ice, when the ice melts, it leaves only about 1/2 cup of water. So you will calculate here 1/2 cup of liquid, which is 120. Half of 240 is 120. Please double check if you have to calculate ice in your dosage calculations. Make sure you follow your college or your facility guidelines on how to calculate ice, because some facilities may have it as 1 to 1, some might have it as 1 to 1/2, or however else they decide that ice melts. In this case, we're doing 1 to 1/2. And patient received 750 milligram of clindamycin from a bag marked 1550 milligram in 500 ml. So this one is a little more complicated because we did not give the entire bag of 500 milliliters, right? We didn't give this much in milligrams. We only gave about half of it. So how many milliliters patient received? We need to calculate the exact amount. Even though we see it's about half, we can't put about half in there, right? Let's calculate exact amount. And we're going to use DKP method and set it up like we always do. We write down what we know first. 1550 milligram is 500 ml. I need to know for 750 milligram, how many ml is that? 750 milligram is X milliliters. 1550 milligram is 500 milliliters. I double check myself. Do I have milligram under milligram? Milliliters under milliliters? Using DKP method, this is very important to have the same measure under the same measure. Next, you find a diagonal that has two numbers that are not X. You multiply these two numbers and you divide by the third number. And in this case, we have 750 times 500 divided by 1550. And after rounding to the whole number, I get 242 milliliters. That's for my clindamycin. And the last item I need to add to my intake is the blood. There's nothing to calculate here. We're just adding it as it is, 325 milliliters. That's for blood. Now we just need to add these numbers and we will have our intake for the 8-hour shift. And the intake that I calculated for my shift is 2,227 milliliters. In this problem, the nurse is taking care of a patient who has an NG tube set to low intermittent suction, and the nurse is irrigating the NG tube. And nurse irrigated it twice with 30 milliliters of normal saline during his shift. At the end of the shift, the NG canister contains 475 milliliters in it. What amount of NG drainage should the nurse record? Let's think logically. NG drainage is something that came out of the patient, right? So it should not include the amount that we put into the patient. So in this case, if 475 was in a canister altogether, then we need to subtract what we put into it, which is not a drainage. And we put 30 milliliters twice, gives us 60. So we'll subtract 60 milliliters. And we will document 115 milliliters of drainage. You will find more problems like this to practice in my book, Dosage Calculations, Getting It Right Every Time. In the comments below, let me know what other types of problems you want to solve together.